for the delay. Welcome.
All right, welcome everybody to our first community chat of the year. My name's Tim Gillette. I use he, him pronouns. I'm the Chief Operations Manager for the Child Welfare and Self-Sufficiency Programs. Before we dive into the agenda here, just a quick reminder that this meeting is being recorded. We'll send out meeting notes and the recording to anyone who has registered for this session. I believe we're going to put a poll up. Hopefully that is popping up soon. So please take a moment and fill out the poll. And then also, in addition to that, we've got a couple webinar specific features. There is the chat where you can put general comments and we'll see those. We've also got the Q&A. So if you've got questions that you'd like to have answered, please put those in the Q&A section so that we can record those. And if we have time at the end, hopefully we'll be able to address a few of those. We're excited for today's chat, and I'm excited to send it over to our new interim director, April Flint-Gerner.
Thank you so much, Tim. I am curious about who all is joining us today and from where you hail. My name is April Flint-Gerner, she, her pronouns. As Tim mentioned, I'm the Interim Director for Child Welfare as of January 1st, 2023. You all may recall that Rebecca Jones-Gaston was nominated by the Biden administration to serve as the U.S. Department of Health and Human Services Commissioner for the Administration on Children, Youth, and Families. In other words, it's the highest ranking child serving position in the nation. We are very, very proud of her. Sad to see her go, but she has reached out recently asking how her friends and family in Oregon Child Welfare are doing, and we let her know that we are all doing just fine. So her nomination was confirmed at the end of December, and she served her last day as the ODHS Child Welfare Director on December 31st, 2022. For those of you that don't know me, I'll share just a little bit about myself, but the work is more important, so I'm going to keep this brief. Before becoming interim director, I served as Oregon's Child Welfare Deputy Director for Equity, Training, and Workforce Development for the last almost 3 years. And I am a social worker, very, very proud of that, with more than 25 years of experience in public service in lots of different jurisdictions in a couple of different states. My real focus has been a passion around system change and system improvement on behalf of children, youth, and families, and the well-being of communities. And obviously, I have a passion for equity and workforce development. Before I became the deputy director, I was a workforce development manager at the University of Nevada, Las Vegas, where I was responsible for supporting the child welfare training partnership that existed for the state of Nevada, and specifically was responsible for training delivery for new workforce, the child welfare stipend program, and the implementation of their statewide coaching model. In addition to my role here at ODHS, I was active in lots of different national initiatives, helping to create child welfare practice models and all kinds of really fun stuff. And so it's with that experience that I kind of came into Oregon and have spent the last 3 years supporting the development of our full equity framework in alignment with the ODHS Equity North Star, as well as the enhancements to our training system to become a full workforce development system in partnership with some of our folks who are visiting with us today. So in the coming year, we're going to be focused on the division's work around the vision for transformation. If you all are new to this conversation with us in child welfare, we have been talking about the vision for transformation since about 2020. Our previous director helped to gather this team that you see before you and meet with community and tribal partners to develop the vision for transformation. And if you are someone who has been a part of these conversations before, then you know we talk about the vision a lot. But for those of you that are new, here are the basics. There's 3 guiding principles. We really want to focus on prevention of maltreatment and the preservation of families. We're focusing on equity and our workforce, and we're focusing on how we use data to inform our decision making. And so the 3 guiding principles, you'll often hear us talk about our work aligning with the 3 guiding principles of that vision for transformation. And so in the coming year, we not only will be updating the vision for transformation based on feedback that we received from many of you in the community, but we will also be providing an update on the vision for transformation and some of the highlights that happened in 2022. And so you'll hear today about some of those highlights, but we will be sharing that information in a format that you all will be able to pull out of your pockets or access on the web page, et cetera. So look forward to that in the new year, but we are not stopping the work of the vision for transformation. And we really want to focus on not just building family preservation as a program, but really building family preservation as a way of being, as a culture, as an outcome for Oregon families. And so as a leadership team in support of all of that, in 2022, we continued to reduce the number of children in foster care from more than 7,000 to under 5,000. We eliminated the use of out-of-state residential treatment facilities. We helped to lead the collaborative development of Oregon's Family First Prevention Plan, which was one of the first plans accepted in the nation with the federal government. And we are continuing to do really, really good work that we're going to highlight in today's conversation. As a part of our program today, we will also be reviewing our other accomplishments in 2022 and provide some insights into some additional work that we're going to be doing in 2023. Some of you have attended previous ones of these chats, and specifically, if you attended our December year-end review meeting, we are recapping some of those accomplishments. So we want to be sure that everyone has an opportunity to get this information as we build upon this work in 2023. So if some of it sounds repetitive, some of this information was presented in December. In that sense, I think I have used up enough words for right now, but I'm going to turn the agenda over to Lacey, who's going to get us started on that part of the program.
Thank you, April. Good afternoon. My name is Lacey Andreessen. My pronouns are she, her, hers, and I'm the Deputy Director for the Department of Human Services Child Welfare Division. It's a pleasure to be with you all today. I do want to recognize that January is National Human Trafficking Prevention Month, and the only reason why my background doesn't match those others that you're seeing today is because of technical issues on my part. So just want to make sure that we recognize that that is the work that is being highlighted on this month. I wanted to spend my time with you today looking through where some of the strategies and implementation things that are happening across child welfare program have happened in 2022. And I'm going to start with an area of practice that we talk about in this and other formats often. You heard April reference it as well. Our partnership between child welfare and self-sufficiency programs has really been a key lever this year in supporting family engagement, meeting economic and concrete needs, and really understanding what changes and what change services will positively impact families. In the demonstration sites for family preservation, we see that more families are being served together in home rather than being separated for the purpose of foster care. And we're going to keep leaning into this work in the upcoming year in 2023 as we expand the number of sites that are demonstrating family preservation and practicing that, and really our ongoing collaborative work, both with self-sufficiency and also community partners, the tribes in Oregon, people with lived experience and individualized communities. So excited about the progress that's been made in that area, looking forward to what's coming in this upcoming year. Another area of practice for our team is the child fatality prevention and review team. It's a statutory response that's required for child fatalities in Oregon for children known to the department. But the other half of that work, and I would argue really important work, is the work around prevention. And they've built out some great interventions across the last year. For suicide prevention, the team partnered with our Oregon Child Abuse Hotline to develop training for screeners to really support their knowledge and awareness of impacts of suicide, risk factors they should consider, and really more information as they evaluate reports of abuse that involve any dynamic of suicide and as they make screening decisions on those. We've also looked at the trends that we see around infant safety and well-being, and across the state made more than 400 sleep services, safe sleep bundles available to local ODHS offices and Nurture Oregon demonstration sites. In regards to addressing and meeting the needs of infants, we've also worked at really funding and looking at how we utilize the CARA plans and captive funding. And we use that funding to support nearly 70 funding requests in 2022. And ultimately, that means that 70 families in the state received assistance with concrete needs and connections. And then partnered with Oregon Health Sciences University, because again, this team is really looking at trends and efforts that would move toward prevention of child fatality. And the partnership with OHSU resulted in the provision of safety prevention kits for resources to ODHS districts across the state. The kits are designed to aid in the preventing of the injury and death of children and promote child safety. And they were delivered in October and November and are available for both child welfare and self-sufficiency professionals who are working with families in Oregon. Just some examples of what's found in those kits: things like window wedges to prevent window falls, anchors for furniture, lock boxes for small firearms, lock boxes for medications, and outlet plug covers. We've also worked on, in that work, community context development, really looking at what are all of the availability in each community, and also where are needs and gaps. And that work is happening in partnership with Child Welfare and Self-Sufficiency to really promote prevention and opportunities to gain understanding of localized community data and needs, because the macro level state view is important. The community level and local level is a really important context to put on top of that. Some great work has happened in our foster care program that I wanted to highlight today. The first is the continued expansion of KEEP. KEEP is an evidence-based intervention that's a support group for parents. We use it for resource parents, and we're looking at expanding that to look at how we serve parents served by self-sufficiency as well. In addition to the work around KEEP, they also designed and are launching right now a respite program. The program will expand across this year and includes respite services to families with children that they're serving in foster care and families with children who are placed in home with their parents. We've done some work around assessing our resource parents' capacity to meet all aspects and identities of children. Really looking at indicators for families that are likely to respect, accept, and support children and young adults, whether it's in regards to their race, ethnicity, and culture, their sexual orientation, gender identity, and gender expression, or really anything else about them that makes them unique and individuals. And we've put into our practice and our procedure manual direction around that to guide our staff as they're working through assessing a family's capacity to meet those needs. I'll talk next about a pilot that we're hoping to expand that has proven effective so far. It's the child-specific caregiver support pilot. And this pilot allows for coaching, training, and resource navigation, also on-call support services for resource parents, relative caregivers, and parents in home. And it's been created in such a way that it can be individualized to meet the needs of any identified child. For 2022, it was initiated in Multnomah County, Clackamas, Washington, Lane, Marion, Polk, and Yamhill counties. And we have an ask into our legislative partners to consider expansion of that during the 2023 session. Our child abuse hotline has been up to good stuff this year. They trained and onboarded 49 new staff and have reduced their turnover and increased their retention rates, which is always good news for workforce. They've also operationalized strategies in 2022 that have resulted in an increase in customer service and a decrease in wait time and abandoned calls. And over the course of several months have shown via the data that they're able to maintain those changes and continue to impact the wait times and abandoned calls in a positive way by keeping them very low. And then they've implemented a new screening and response tool that's called structured decision making. And they'll really spend this year evaluating what's worked and what they can continue to tweak and change to make it the best experience for the caller and the best response from the screener. Finally, from me, I wanted to highlight one area in terms of placement capacity and partnership with OHA. A current expansion is being worked on to increase the number of beds that are available at the Looking Glass Regional Crisis Center. That center provides psychiatric residential treatment and also assesses services and needs for all children, for any children that's placed out in the care and custody of child welfare. And those placements are available specifically for child welfare. So in wrap up, 3 highlights for me from this year. The first, the reduction in wait times. We've heard from community, we've heard from mandatory reporters, we've heard from our partners across the state. Well, prior to us learning how to manage it differently, how difficult it was. And since having made some of those changes, how effective they have found being able to call the hotline and have someone answer quickly. So we're very grateful and proud for that work. We also have dramatically increased the timeliness of case plans. We are required by statute to have a case plan for a family when a child enters foster care within 60 days of entry. And because of some changes that have been made to the forms and the business procedure and the training to caseworkers and staff, the timeliness of case plans has increased dramatically over the last year. So we're excited to see that. And then my last highlight and reflection is a really incredible partnership that we have with a community stakeholder called Project Never Again. P&O's founder's mission is to ensure that whenever possible, children and young adults entering foster care or experiencing foster care or leaving foster care always have duffel bags and nice packaging and luggage to take their things with them. And those have been distributed across the state for multiple years. And we now have some data to support how many of them are being utilized and being handed out to children and young adults in our system. With all of that, I'm going to turn it over now to Alicia, who has additional information to share about CQA.
Good afternoon. I'm Alicia Cox and my pronouns are she, her. I'm Deputy Chief of Strategy and Innovation, and I'm happy to be here with all of you. I do have some great updates that I like to share because, as continuous quality improvement is embodied in our guiding principle number 3 in our vision for transformation, it really sets forth the foundation that we're looking at all avenues of improvement using data to inform our decision making. And as part of that is to have a team, a continuous quality improvement team and infrastructure to help carry out the statewide program. The continuous quality improvement manager, 2 CQI analysts, which started last spring, and then the 5 analysts that were hired in December really fill out the entire team minus 1 position. So we still have 1 position open, which is our tribal relations continuous quality improvement analyst. This position is key to build out and strengthen in partnership with the tribes in the state of Oregon, also to build out data literacy and to ensure that they have access to tools and data to also start their own continuous quality improvement programs to fold into what we're doing within the state. And then again, learning from them what they've been doing in terms of improvement in case practice. As part of the CQI cycle implementation, the goal was to do a slow rollout of several sites per quarter as it aligns with our Child and Family Services Review, which is our CFSRs, our federal review that we have on an annual basis. It goes to all sites, all districts around the state of Oregon. And we aligned with the CFSR team and the data they provide, the qualitative and quantitative data, in conjunction with our community data to really build out a robust and holistic approach to improvement for continuous quality improvement in child welfare. As we roll out to the different cycles partially throughout this year until July, that's when we'll roll out it fully to the entire state. Right now we have District 6, which is Douglas, District 12, Morrow, Umatilla, District 1, Clatsop, Columbia, and Tillamook, District 14, Grant, Harney, and Malheur. And then we'll be rolling into District 2 with Gresham and a few more sites for our winter. So very exciting as we have now almost a full team for continuous quality improvement to build out that capacity, to be in the community, to talk about our data, the integration of our data tools, which is demonstrated in our federal performance dashboard, and using that to really provide insights on what are some feasible and sustainable continuous quality improvement strategies so that we're building out a program that's going to be long lasting and sustainable, not just coming and putting in a band-aid on something, but really digging in deep into root cause, identified what are those leading measures that are going to change our practice to get those long-term outcomes, those change in those long-term federal performance measures in which we see on our federal performance dashboard. So it's exciting to build out a data report that is pertinent to the community in which we're supporting the continuous quality improvement efforts. We have tribal nation representatives, community members, ODHS staff, persons with child welfare lived experience, legal partners, resource providers, to really sit around the table to look at our data in our current state, really opening the doors on these opportunities and having conversations around improvement and being curious about the data, knowing that we have some room and opportunity to grow, but building out a robust perspective on improvement and really eliciting conversations and hard, not hard, uncomfortable, not comfortable, to really dive into this realm of opportunity. So it's been an eye-opening experience to have this power sharing and building out the consensus on what that particular site is going to be focusing on throughout the CQI cycle. The CQI Advisory Committee was also formed and continues their work in the data equity vision statement to really center our work around how is this data harming, not harming, including, not including the population in which we serve, and having those persons with lived experience and tribal representation at the table as we're looking at the strategy plans being built out by the community to provide other considerations that we have not yet looked at. So having these feedback loops within the community and then at a statewide level with the advisory committee, we're trying to build out a table of curiosity around our data and then also eliciting and pulling in and collaborating on different strategies in which we can incorporate. Our federal performance measures dashboard is a year old in a few days. So if you have not yet seen this, this is the federal performance measures in which we look to on an annual, they're annual measures. So they see where we stand currently in permanency, where we are on timeliness, et cetera. So the data points that Lacey was referencing, these points are found on this dashboard. And these are the ones we are wanting to improve. So when you see the opportunity in a particular district, the focus is to improve those measures by using these very key and very structured improvement strategies. So very exciting to see improvement in the growth over time around improvement and capacity learning with continuous quality improvement methodology. We're also seeing an increase in face-to-face measurements. We had a pretty robust strategy plan for District 12, and they're seeing a 10% increase in face-to-face contacts. And of course, it's not just meeting with the family, it's creating a quality visit. And that's super important to engage families and create a space that's safe, that is supportive and affirming for the child and families, so that we're getting some quality face-to-face time and being ensuring that our communication is clear and that everybody's on the same page so that we can work together going forward. And we're seeing that intentional improvement and intentional strategies on our continuous quality improvement plans. And that's very exciting to see such incremental growth in such a short period of time. So we're hoping that momentum will continue in the other districts who have also identified as face-to-face contacts and parent engagement as our lead measures for their continuous quality improvement strategy plans. Another area that I'd like to share is that if you have not yet seen the announcement, we have a website called ROM, the Results Oriented Management website. And this lists out quite a few data points for child welfare, but also gives you a way to look at the reporting and the filters. So it gives you some opportunity to fiddle around with the data, look at where we are for the number of entries into care, et cetera. We can drop the link in the chat for both the Federal Performance Measures Dashboard and the ROM website. It's going to be doing a little facelift, a little refreshing of the tool so it's easier to navigate. We've got some feedback that it's not the easiest tool to navigate unless you're someone who really likes to dive in deep with data, but using this opportunity to take a look at that website, use this new interface in the next few weeks, and then provide some feedback to us as we continue to refine our data tools and continue to provide accessibility to those tools so that we're being transparent with where we are with our data. Do appreciate the time that we could share our continuous quality improvement efforts and, of course, all the good news about the data and tools and the opportunity to share those out. I will pass it over to Tim.
Thanks, Alicia. Hi, everyone. Again, I'm Tim Gillette. I use he, him pronouns. I'm excited to share a couple of things that we've done kind of behind the scenes with our business operations teams. For example, we did a refresh after COVID and wildfires and things like that on our continuity of operations plan. And we did a real good job of also going out across the districts and helping them get started on their COOP plans locally as well. We also are doing more work with our self-sufficiency partners to try to get more consistent in our processes and how we do things, including position management, our budget operations, and contracts. We also had our federal partners come visit us. They did a criminal justice information services audit. And the result of that audit was that we passed, and in fact, we're moving a lot of things in the right direction. So that was a great result for us. And finally, our ORCIDS technical team did a lot of work in our system to make life a little easier for our staff. We did some major updates to our screening module, our family report module, family first and person management modules. And we also rolled out our structured decision-making tool at our 24/7 hotline. In addition to that, we did some quite a few minor updates that are small but crucial updates that again make life a little easier for our staff. We're excited about what's to come in 23, continue to make improvements in the system, as well as continuing to try to make changes behind the scenes to help things go smoother for our staff and in turn make things a little better for the families that we serve. April, I believe we're going to go back to you.
Thank you, Tim. This is April. I'm going to talk a little bit about some of the things that we accomplished around improving our equity efforts last year. So many of you know that we have, as a part of the Vision for Transformation, been working on a racial equity and social justice tool that sits on top of our policy decisions to help us mitigate potential unintended consequences or harm that can come from such large-scale policy changes without the voice of community. So that tool has been in implementation for over a year now, but we've also implemented in 2022 a racial equity and social justice review committee. And with that group, it's comprised of youth with lived experience, staff from every position, and community partners. And their job is to make sure that that racial impact tool process was completed, that community have had an eye on the changes that we're trying to make, and that there are no unintended consequences that will result from the implementation of the suggested policy or rule. We've also expanded our child welfare, race, and equity leadership team and have implemented a weighted decision-making process to center the decision-making power of the voices of those people who have been most impacted by our system. We recently selected and hired a new child welfare service equity manager that works with the Office of Equity and Multicultural Services. Child welfare has never had a service equity manager before, and so we're really excited about continuing to move the work forward of making sure that we're looking at our data to understand who's most impacted by our system, partnering with them to transform our system, and obviously really leveraging those relationships with our community to make sure that we are being accountable for improved outcomes. To connect with diverse families and to make our spaces more welcome, we implemented sensory rooms this year. Our sensory rooms are therapeutic spaces with equipment to help calm, soothe, and focus children and families. This was a project that started at the beginning of the year, and now there are sensory rooms completed or at least in the process across most branches in the state. We have done lots of work around providing ADA and disability staff resources. So we developed and distributed some ADA disability staff guides throughout 2022. Everyone participated in mandatory ADA training. And so all staff have gotten enhanced training resources and tools. And we also implemented enhancements to our case management technology system to provide additional tools for staff to identify and support children with disabilities. And that's just the tip of the iceberg. There's so many other things that we've been able to get accomplished this year in partnership with our communities. And so stay tuned for our written update on the Vision for Transformation, where we will be able to provide more information. A couple of key highlights regarding training. Many of you know that we launched our new Resource and Adoptive Family Training Series, and we're very pleased to have achieved this milestone. It was years of work in the making in partnership with our community. After finalization of that curriculum design, the launch occurred in May 2022 statewide. We've implemented or completed 40 of the cohorts for the Resource and Adoptive Family Training Series for new families. The curriculum has been translated into Spanish for the first time, and we are also hiring bilingual training staff to support the delivery in Spanish in 2023. We also, within this year, hired a full team devoted to resource parent training. Again, a new thing that we've never had before. And so on our public facing page, there are some just-in-time trainings for resource families or anybody else who wants to take them, and we will share the link in the chat. We also have built a brand new training team. Most of the folks for workforce and most of those folks have been hired recently, and so really look forward to lots of skill building enhancements, training enhancements for our workforce in the new year. And then lastly, wanted to kind of highlight that we had some support from some national technical assistance and our ALIA partners. If you haven't heard of ALIA, they are doing transformational work across the country and helping systems to become focused on more family preservation and not relying on separation of children from their families in order to serve them. And so we had some great technical assistance and training from them around all kinds of different things, but really worked with our CPS supervisors, permanency supervisors, our program managers to really think about a new way of work, keeping families together, focusing on keeping families together, focused on resilience and building new paths together. Some things to look forward to in the new year. We are launching a new coaching initiative. If any of you have heard me talk about workforce development before, we often overly rely on trying to train away our problems, and most adult learners only remember about 5 to 10% of what they experience in a training. It really is reliant on coaching. How you're coached is how you behave. And so we have never had a coaching model, statewide coaching model in child welfare. And we've been spending quite a bit of time in 2022 picking a model that we're going to start implementing in 2023. So we're really looking at the ways in which coaching can improve and enhance the skill set of our workforce. So we're going to talk a little bit about some other things that are ahead for 2023. Lacey and I are going to talk a little bit about that, but I'm going to let Lacey start us off. Lacey, turning it over to you.
Thanks, April. I'd like to highlight really the work that's happening in 2023 around the capacity of the system to serve children and their unique needs well, both in terms of placements and also getting services in time to children and young adults experiencing foster care. The first is a partnership between Oregon Health Authority, Oregon Youth Authority, and ODHS Child Welfare to support a co-facilitated children's continuum rate study. It actually came as a requirement with House Bill 4012, and we all have worked with a third-party contractor, and that provider worked with community to consider all of the rates and ways that we fund and pay for psychiatric residential, day treatment, substance use disorder residential, intensive in-home behavioral health, and BRS. And the goal of the project is really to look at what is the actual rate that those levels of care need to be sustainable and meet the needs of children who are placed there. The recommendations will be submitted to the legislature by the state agencies in February of this year. And the goal of it is to really, the project is to span this over this year to move towards a structure that reimburses for actual costs and meets their needs. And so we'll be partnering during this legislative session to communicate the results of that rate study. The other service and support area that I wanted to highlight is our goal of expanding our resource and support network in 2023. It's currently a collaboration with Care Oregon, but we're interested in other CCOs across the state partnering with us to create this opportunity. It is a unique support where we have a mobile response support service, and we offer seamless connection to services, in-time needs for services, and are really looking at prioritizing and looking at priority populations for that. And it really brings highly trained and trauma-informed specific supports to children and their caregivers in an in-time way. So we've seen some success with it so far. We're currently in Multnomah County and Washington County and looking to increase and expand that across the state. April, back to you.
Thank you, Lacey. It's April again. So, and finally, we have to continue to strengthen our partnerships with communities and tribes. And we really look forward to, in this new year, implementing a formal tribal consultation policy and procedure with each of the 9 tribes in Oregon that help us do that and co-create and adapt venues for accountability with communities to share power and transform our system. And so some of the things that you heard from Alicia as she talked about our CQI system is attempting to do that, right? To be able to create these processes where we might have an intention on implementing something that is a good idea, but if we don't hear back in partnership with our workforce and our community, if the things we're trying are working or not, then it's hard to know what to fix, right? And so we're looking forward to our work with staff and partners to continue our practice enhancements that help our staff feel more confident and competent, that they can have what they need for the job to be doable, manageable, and where family engagement is the force that drives the work, and working with our self-sufficiency partners and staff to deepen our alignment to support true prevention and family preservation. We spent the summer focused on really developing some roadmap kind of features to the vision for transformation. It's one thing to talk about these things theoretically. That was just the start, right? We needed to have guiding principles, things that we needed to focus on. We needed to have a vision. System change doesn't come because we all really want it to. We really have to have a vision and a mission and some goals and some things that we can point to that say we're headed in the right direction. And this is a really big system. And so as much as we have things that we need to work on and enhancements that we need to continue to make, we're really asking for your partnership and your patience and your guidance. And we recognize there are still things that we need to fix. We know that, and that it's going to take time. And so we're really asking again for you to continue to communicate with us and to be in relationship with us so that we can partner to get it right and to do better. And so one of those things is really saying, if we want to get to a vision for transformation where our workforce is better supported and engaged, we have equity at the center of our work. We're using our data to understand how well we're doing and how well we're not doing, and where we need to fix things, and where we're really focused on family preservation and prevention of things happening to children before a family reaches crisis. We really need to share power also with other parts of our system. Child welfare is not the end all be all of serving children, that we really need to work across the child serving system to look at the things that are impacting families and say, is this a child welfare thing, or is this something that can, where a family can be served by our self-sufficiency partners, so that child welfare doesn't have to get involved. And so some of the things that we're really looking forward to in those roadmap sessions have been better alignment across our self-sufficiency program, better partnerships with folks that are out there in the community. And we're really looking forward to continuing to get feedback, to be in partnership. Like I said, we have a huge well-being initiative at ODHS that we're a part of, that really is about whole family, multi-generational well-being. We have regional demonstration projects where people are trying out some innovative things in the regional levels, and some strategic planning that we're working on. So lots ahead for 2023. We really love being able to come and share these things with you. We know that there are a lot of questions coming up. We want to invite you all to submit your questions ahead of time. There's opportunities to submit your questions ahead of time so that we know what you all are wanting to hear about. So while we're in these Zoom webinars, there is a Q&A section, and it's a little easier to track the questions when they come into the Q&A. If you put them in the chat, sometimes they can get a little lost. And so want to encourage you all to put those questions in the chat. My email address, the director's email address, has been shared in the link. And so those of you who are looking for support and help, please don't hesitate to reach out and submit that question or concern via the director's email. I believe, and I'm going to turn it back over to Tim, we may be answering a couple of questions. We have time, if we have time.
Yeah, in fact, I think that is where we are at right now. So I think Lacey was going to take the first question.
Yeah, thanks, Tim. April just alluded to it, but I wanted to flesh it out a little bit more from two perspectives. We've gotten some case-specific questions today. We've also gotten a preparation question prior to today about community partnership relationships. So for those of you who are advocating for someone experiencing the system, if you are someone who's experiencing the system and you're not getting what you need, in each district, we have counties and then districts, and there's supervisors, program managers, and then a district manager. I would encourage you to reach out to those teams. They're there to assist and help and navigate when things aren't working out for you or you're not getting what you need. We also have the Governor's Advocacy Office. It sits outside of ODHS individual departments and is a place specifically to research and address what things may be happening for people who are receiving services from ODHS. From the community partner perspective, we had a question about how to connect locally, and actually the answer is pretty much the same. So that leadership team within your county and your district is a great way to make connections, understand what families need and what you may be needing, and how you can partner and help on the local level and also on the statewide level. So those are all people who serve as resources for you. And then always we have the director's email that comes to this team as well, so we can help in any way we can. April, we got a question about the ongoing work of training and retention of staff, and really kind of highlighting the importance of that parent caseworker relationship. So anything you would add from what you've already shared today about the work that we're doing in that venue?
Yeah, that's a really great question. And so just to be clear, we got a question about, it's critical that the relationship between a caseworker and parents and children is absolutely linked to, folks successfully kind of get working and navigating through the system and helping to get what they need and enhancing child safety. Part of the question was really about long-term plan for workforce stability and retention. We have, when I first got to the state in 2020, we had training partnerships and that have been doing great training around the state. but we really didn't have a full workforce development framework or infrastructure. And what I mean by that is you really have to work with community and universities, colleges, those kinds of things to really invest in the workforce almost before they get recruited so that we're hiring the right folks. Who you select is just as important as how you train them and how you coach them. And if you're recruiting and investing in people who really want to give back to the community or who have experienced, let's say, the foster care system, for example, that is one element of a full workforce development framework. And so when we developed the workforce development team, we have a leader that is going to be focused on that kind of effort, partnering with HR to make sure that we are attracting the kinds of folks that really want to do this work, getting them resources early so that we're not putting all of the burden on getting them ready for the work after they've already been hired. Also, a part of a workforce development framework is having consistent onboarding expectations. And so that team that's just been hired, they're just getting started to kind of look at what is it that we know we want to make sure every single person who works in this agency has at the ready, and what skills do they need as they're onboarded to get more support, to making sure that we are centering that important engagement and how you build those relationships and rapport with community. And then there's a couple of other things that are being added from that team that got created. Like I said, that coaching model is really important. And we also have a workforce well-being coordinator now that we didn't have before. And so staff support, leadership development, coaching, all of these things are things that did not exist. And so that team that we've just hired is going to be focusing in this next year and beyond and greatly increasing our engagement with our workforce around the skills that they need, around leadership development, succession planning, professional readiness, and just really helping them to be more confident and competent. We predict that we are going to really be able to see not just retention improve as a result of that investment, but the workforce feeling like they are, more valuable, feeling like they have more skills and resources to do that really important engagement. And lastly, I would just call out that one really important relationship with this executive leadership team is our Parent Advisory Council. And we meet regularly with this amazing group of parents who've experienced our system, and they hold us to the fire. They really do. They come and they bring the things that are working well that they see, and they bring the things that are not working well. And we really get to strategize together about what is it that we want to do? What is it that we want to see change and grow? And so having the critical voices of parents that have experienced our system in relationship with us as we design system improvement efforts, I think is more important in some ways than having the right workforce, right? We need to make sure that what we are bringing to the workforce is coming from the very voices of people that have experienced our system. I think, Lacey, you have another question that you're going to answer.
I do. I was asked prior to this chat about whether the potential increases in foster care maintenance payments that are being requested would impact or change the payments that families who are in adoption and guardianship assistance have. And the short answer is yes. And so if the maintenance payments are increased by the legislature, then we will consider how we match adoption and guardianship payments as well. One thing I would just say in caveat for everything we've talked about today around requests in the legislature's policy option packages is we all work for the governor, and she is in her process now of putting together what the governor's recommended budget will be for the state of Oregon. We will be directly in alignment with what she's seeing as the need across agencies. So probably by the next time we're all together, we'll be able to share with you what has moved forward in the governor's proposed budget and where we see ODHS child welfare falling within that.
I'm trying to see if there are. You know, there was a question that came in about supervising visitation after 5 o'clock. And I just wanted to say, you know, if we look at the vision for transformation and if we are in alignment with it, then we are adapting our services and supports to meet the needs of the community, not based on centering our comfort. And so we really are looking at what can we do to make sure that we've got staff available to meet the needs of the community and in alignment with good community engagement, right? And so I remember being a caseworker and I have my own child to get home to at the end of the day. And so it was hard for me to supervise visits after 5 o'clock. But we ended up advocating as caseworkers to have some additional supports after hours for those families so that my limitations in terms of my family weren't being centered, right? That the needs of the families that we're serving are being centered. And so we're really open to kind of looking into what we can do to look at alternative shifts and those kinds of things. So those are some of the conversations we've been having. Again, you know, we want to be accountable. We want to center the needs of families, and big system change takes some time. So I don't want you to hear, you know, we're looking into it and next month we're going to have alternative schedules. But what I can say is that that idea and hearing from community that that's important is the thing that we then raise up with our team to say, what can we be trying out at the district level in terms of how schedules are arranged to make sure that we are both balancing the workforce needs, but that we really are centering the needs of families. And so I really appreciate that question, and to let you know that we've already been in some conversations about that. I think we are running low on time. And so is there any other question that we can answer here quickly? It looks like some folks have had some trouble with links or they're wanting additional information. So we see your questions. We will make sure to reach out to you and get you the information that you're requesting. And if, yep, there's a few folks who've submitted questions, and we will absolutely take note of those and get back to you.
Well, I want to thank you all for coming today, for spending time with us, for participating, for listening. As April said earlier, we are not an island, and we cannot do this without the connection and support of community across the state. And we'll keep doing this. So we'll keep showing up. We hope you will too. Take advantage of the registration. Be sure to submit your questions in advance whenever you can so that we can incorporate them into the body of what we intend to share. And take good care.
We really appreciate you coming today. We appreciate the comments and hear you in terms of things we need to continue to work on. And noted, we definitely have work to do, but we're committed to being here in partnership with you. So thank you all again for coming. And we really hope to see you again in the next quarter. Take care. Bye.